Hi there, my name is Dr. Chengyuan Wu, and I'm a neurosurgeon specializing in surgical treatments for conditions like Parkinson's disease, essential tremor, and epilepsy. In this video, I wanted to introduce you to deep brain stimulation, or DBS, what it is, how it works, and why it might be helpful for some people. So what is DBS? Unfortunately, we didn't do ourselves any favors with the name of deep brain stimulation, but it's really not as invasive as it sounds. DBS is a treatment that relies on a small implanted device to help control symptoms related to movement disorders, epilepsy, and a growing number of other diseases. It's important to know that the main goal of DBS is to improve quality of life. So while it doesn't cure these conditions, it can significantly improve day-to-day function and overall well-being for many people who struggle with symptoms. To do this, DBS works a little bit like a pacemaker, but instead of helping the heart, it helps the brain. So how does DBS work? The DBS system has three main parts. The first part is the electrode. This is a thin wire that's carefully and very accurately placed in specific areas of the brain. In fact, the electrode is thinner than a piece of spaghetti. These wires are the business end of the device because they deliver tiny electric pulses that help regulate abnormal brain activity. Now, some DBS systems can even record signals from the brain in addition to providing stimulation, giving us helpful information about brain activity in that particular patient. The second part is the extension wire. This is a thicker, more durable cable that connects the electrodes to the third part of the system. The extension wire needs to be stronger because it passes under the skin of the neck and must withstand the daily movements of head turning. The third part is the implantable pulse generator, or IPG. This is the brains of the device, and similar to a pacemaker, it's implanted under the skin just below your collarbone. The IPG contains a mini computer that sends electrical signals to help manage your symptoms, and also houses a battery that powers the device. Now, just to avoid any confusion, it's important to know that all of these parts that I've talked about are implanted under the skin and are not easily seen once they are in place. So, with a system like this, what can it help with? When the stimulator is on, the electrical signals don't damage brain tissue. Instead, they act more like a reset button that helps improve brain circuit activity. For many people, this can mean better movement control, fewer tremors, fewer seizures, and in some cases, lower doses of medication, which can also mean fewer side effects from those medications. For many patients, DBS often makes everyday life easier, whether that's eating out without spilling, moving around more comfortably, or just feeling more confident in social situations. I'll talk in more detail about exactly who is a candidate for DBS in a future video. But briefly, DBS is most commonly used to treat Parkinson's disease, especially when patients start to experience motor fluctuations or medication side effects that are difficult to manage. It's also an option for people who suffer from essential tremor, who have severe shaking that interferes with everyday tasks like eating, drinking, writing, getting dressed. For those with dystonia, DBS can help reduce muscle contractions that cause painful and abnormal movements. And in some cases, DBS is used for epilepsy when other treatments haven't been effective. Now for some final thoughts. I'll emphasize again that DBS is not a cure, unfortunately. As far as we know, it doesn't stop the progression of Parkinson's disease or essential tremor or epilepsy. But because it's a quality of life surgery, DBS can dramatically improve symptoms and make everyday life easier, which is a big deal. If you or a loved one is struggling with symptoms that aren't well controlled by the medications you're on, DBS may be an option worth exploring. It's a big decision, and it's important to have a conversation with your neurologist or neurosurgeon to see if it's the right choice for your situation. If you have questions or specific concerns you'd like me to address, please let me know in the comments below. And if you found this video helpful, I encourage you to subscribe so you can follow along with the rest of the series. Thanks for watching.